Dr. Meenal,
Yes,
could we start now?
sure.
Okay. Please start the session, Dr. Namita.
Good evening, all. I welcome you all to the Excel seminar series, which is collaborated with Other Song Academy and IHMA Piravam. I take this opportunity to give sincere gratitude to our father Dr. Samuel Hahnemann, who provide us an opportunity to bring back sick to cure. Now, I introduce today's faculty, Dr. Meenal Sohai, who has taken MD in Materia Medica and counselor, regression therapist, practicing homeopathy over 25 years, specializes in treatment of psychology and psychiatric disorders, study of mind-body connection. She has been a teacher in homeopathic colleges, corporate trainer and healer, has been a health talk show participant on CTV and other channels, and has her own publications on parenting, stress management, etc. I welcome you, ma'am.
Thank you so much. So, should I start?
Yes, ma'am.
Yeah.
Thank you so much. So, let me share my screen with you all. Good evening and very warm welcome to all of you. And thank you, Namita, for introducing me so well. So, today I'm going to discuss with you a case of migraine. And I have not gone into the clinical side of headaches and migraines because we all know the clinical side. I'm focusing today on the homeopathic management of this particular case. And what I want to really share with you is how I thought about this case, how I received this case, how I understood and analyzed this case, and how I came to this particular remedy. Now, the peculiarity of this remedy is it's a lesser known remedy. I haven't used this remedy so often previously. But what I realized in this case and in many other cases is that if we do a group study of the remedies, if we understand the group very well, then with the help of group symptoms, we can spotlight or zoom into a particular remedy. And with some keynotes, then we can make a very good prescription, even of lesser known remedies to us. So let me first start describing you the case. Today I have chosen a paper case with you to share with you all. So this person is a 75-year-old male, and he came to me with chronic migraine, and he said, "Doctor, I have this complaint over 30 years." And the disturbing fact for him was that this migraine was preceded by some visual aura. Now, we all know what that means. There are some visual disturbances. So he would get flickering of his eyesight just before the headache. Once the headache would start, this flickering would go down. So that was the complaint. That was the presenting symptom with this person. Now, he said, "Doctor, I have been on antidepressants and anti-anxiety medication for a long time, because my neurologist understood that this was not just my migraine, but I had severe stress. And this stress was causing this migraine in me. So I have been on these antidepressants, anti-anxiety, and I want to even quit these medication. And I want to start with homeopathy because I'm just fed up taking painkillers almost all my life." So he says that I am very, very stressed because of my work. And I get racing thoughts. I can't stop thinking. And this is now especially affecting my sleep. Now you can imagine a 75-year-old person who's still working in full-fledged consulting role, and he cannot stop thinking, and he feels extremely worried about that because he's getting disturbed sleep now because of that. He said, I have also been detected with low sugar and I cannot tolerate hunger if that happens. And he said, "Doctor, to tell you very frankly, I've had bad life. I had a lot of joy in my life. I had a lot of success, lot of achievements. I have a very good, fulfilling family with grandchildren. Now, when somebody is narrating to me his complaints and suddenly goes on this path of describing how his life has been, I get a hint that getting success and getting achievements in life is very important for him. Otherwise, why would he even mention it? So he tells me that I have a lot of success and lot of achievements, and I have had a joyful life with fulfilling family. And I have been a renowned professor and researcher with a 40 plus year career. And I always have worked with Government of India. And recently, doctor, I created a very reputed technology center for Indian government. And it took too much of me creating this center. I had lot of stress, lot of tensions. There was a huge burden of creating this center. The entire responsibility was on me. And it was a pressurizing event for me, he said. So now you can slowly get an idea of what kind of a person he is. At 75 years of age, he is doing some very, very important intellectual work. He's still researching, he's still creating a technology center, and he can take that kind of stress and burden of working for Government of India, which is a very high profile job that he has got, he tells me later. And he gets really stressed because of this kind of work that he's doing. So interesting. I allow him to share whatever he was sharing. Generally, my way of case taking is that when the patient starts talking, I refrain from asking any questions, because I understand that when the patient is talking something, those things are important for that patient, and those things are clearly connected to what he has come for. So those things are connected with his chief complaint. So I generally don't interrupt the spontaneous narration. And he goes on, he says, doctor, this was my first project. And when a similar second project came to me about now creating another technology center, I completely became sleepless. So this was actually a red signal of danger for me. And the migraine increased so much that I almost started taking 3 painkillers per day. Now, why is this narration important? There are two things in this narration. One is that he says that when the second project came, I became sleepless, which means that whenever he has to innovatively create something, he becomes sleepless. And how he perceives the entire situation, he says that it is the red signal of danger. So his work, his project, in his perception is something dangerous. And when something dangerous happens, he becomes sleepless, he gets his migraine, and the pain is so much that he needs 3 painkillers a day. That's interesting for me. So I allowed him to talk more. So, doctor, now the intellectual work has become impossible. I just open my phone, try reading something, even a message, and I get shooting pain in my head. Or somebody simply tells me to fill out a form, like you told me to fill out your form. And I said, that's not possible. So he told me that if I try filling out your case record, it will give me headache. So don't ask me to do that. So that was interesting. Now he says that doctor, silly things are now bothering me. You know what? The other day in my society, there was a gathering, and I really, motivated people to come for the gathering. I arranged for a few things. And in that program, they forgot to thank me. They forgot to mention my name. And that bothered me so much, doctor. So I feel that they should have some gratitude. It is, I feel it is injustice that they don't give me recognition. And later on, I felt so silly about this. I am such a renowned professor. Why should I bother about some society event? So now you slowly start realizing what's happening to him. He feels that people should give him importance, people should value him. And if that doesn't happen, he feels that that is injustice. So We are slowly gathering details from this spontaneous narration. Mental work is impossible. He perceives his work as something dangerous. He feels that his value should be recognized. Let's go ahead. So spontaneously he comes to headache. He says, doctor, do you want to know about my headache? So my headache is generally right-sided. It's either supraorbital or temporal. And I get flashes of light, flickerings of light around 15-20 minutes before my headache. And then the sight would clear and the headache would start. This is usually what happens. And I get extremely anxious when that starts happening, because I know when the flashes start that I'm now going to get terrible headache. And this headache, then I close down my room. I put off all the lights because I can't tolerate light and sound. And generally, if I go out in the sun, or as I told you, if I just try to fill out a form or look at my mobile, this headache would just start and increase a lot. So any kind of slightest mental exertion would increase my headache. He said, so I clearly asked him what makes it better then. So he said, either I bandage it tightly or I ask somebody to press. And the harder they press, the better it is. So he needs very, very hard pressure. Now, just focus on the words that he's using. Where does this word pressure we have heard earlier? He said that his work of creating this technology center was of a lot of pressure. And now he describes his headache as something that is better by hard pressure. Now, let me tell you one thing. From my clinical practice, I have learned this very important lesson. A local modality is very, very important, because the local modality is what the patient is feeling inside. I'll explain to you what I'm saying. So if suppose patient says that I'm better by putting lot of pressure on my head, which means whatever situation is causing the headache is putting lot of pressure on the patient. So generally, I understand that whenever patient says that I want to apply local pressure, that is how is the feel in the client's life or the patient's life. Now, you will see invariably the opposite is true for a general modality. So if somebody feels pressurized, then depressurizing will make him feel better as a person. So what is missing in his life is a life free of pressure, a life that is carefree. So he will generally feel better in open surroundings where there is no pressure, nothing that is compressing him. So this is a very peculiar thing that I have noticed in many, many patients. A local modality like pressure is generally the feel, and the opposite feel is what the patient is looking for in his life. Now, internal, and the next thing that he says is, doctor, I feel there is a lot of internal pressure in my head, as if my head is going to burst out. And when that starts happening, the internal pressure, I can't sleep because my head starts getting very, very hot. Now, here we get some very important physical symptoms. Right-sided headache, supraorbital or temporal. There is a feeling of internal pressure and bursting out. The head gets hot, as we can expect. If heat is aggravating, obviously sun will aggravate. Light and sound generally aggravate migraine. He is aggravated by mental exertion, and he's better by hard pressure or tight bandaging. Very, very important symptoms. And we will utilize this in our repertorization. But before that, let's go ahead and let's understand what he tells more. So again, he starts talking about his life, and he says, doctor, in these 30 plus years of career, I am working on a very, very high priority project or high profile job. And my heart is always under a lot of pressure. Do you see how this pressure word is repeating time and again in his narration? There is pressure in his head. He is better by applying pressure. There is pressure in his project. There is pressure in his work. He says that these projects are very high profile, It's very, very expensive. 300, 400 crores are invested. And now what's his job? If anything fails in this project, he is supposed to do the failure analysis. Now, do you understand why success is so important? Because if the project is not successful, who is blamed? Who is supposed to do failure analysis? This client of ours. So he is the one who's blamed because he is responsible for taking care of things, and he has to defend. That is his job. So others will corner you, others will attack you. And that is a very tensed feeling for me, doctor, because I have to fight it out. Now, do you see why he sees or he perceives his job as something dangerous? Because it's a very high profile job. If this fails, he will be blamed. He has to defend and fight it out. So he says that I have a very, very honorable career. I have rarely had the stigma of equipment failure. But whenever that happened, I was made the scapegoat. I was blamed. And this nature of work itself triggered migraine for me because it is an extremely risky job. That meant that there is always severe pressure and responsibility on me. So now we slowly understand why he perceives his job as something dangerous, something very risky, because he will be blamed and he has to fight it out all the time. So some more very, very important points about his life. Now, ask him that, are there any more things about you as a person that I need to understand? Generally, when I am very clear about what is the chief complaint and what is causing this kind of complaint to him, now the connection of the headache and his work, which is causing the headache, is very clear to me. There is a perception of risk and danger, which is causing a lot of pressure. And this pressure is manifesting at the level of head. And obviously, the mental exertion, the racing of thoughts, all this is aggravating him. This much is clear to me. Now I want to know, is there anything about his personality that I need to know? So I ask him, and he says, Doctor, I'm very ambitious person. I'm very adventurous. And of course, I'm a perfectionist. If I have to deal with such high pressure jobs, I need to be extremely meticulous in my work. I didn't get bullied by challenges. My work was extremely challenging, but I enjoyed them. Now, he's someone who enjoys the challenges, meaning the work is risky, the work is dangerous, but he still enjoys that. I never pleased my superior. In fact, I was very blunt. So many times I felt that my promotion got delayed because I didn't please my superiors. And so many times I felt my non-deserving colleague got it. Again, where have you seen this particular facet repeating? I work for my society. They didn't even mention my name. So I am not getting the due credit of my work or due value of my work or due recognition of my work is a theme that repeats again now. It's tightrope, doctor, that I walk every day. And I had to put out the mistakes of other people also bluntly, which hurt them occasionally. But otherwise, the blame or the failure would come to me. So he was somebody who would openly discuss what are the problems in the job. And that is the tightrope to walk. Again, something risky, something dangerous. If I think about it even now, my head gets hot. Even when I do intellectual work or even when there are fights or conflicts. So even when thinking about those conflicts, the way he had to fight out the blames, his head gets hot. So getting heated up seems to be very important aggravation and seems to be very important aspect of his headache. Now, he said that I many times got angry at this injustice. People lie at work. There is so much mediocrity, and I don't like. I'm a perfectionist. And these days, I keep thinking about the grudges from the past. Do you remember him saying that, I keep thinking about silly things about how people don't recognize me? Now he says that I keep even thinking about what happened in the office, the injustice done to me, the offenses done to me. And he even told me that his mother was unwell, and that's why in his engineering college he lost 1 year, and he felt as if this is a blotch on my career. So remember, the equipment failure is a blotch, and I was made scapegoat. So these in this way, when you allow the spontaneous narration of the client, you see the same themes repeating in his narration. Now, I feel that if somebody finds out about my engineering college, I will lose value and respect. So this theme of value, respect, recognition, and not getting the recognition, injustice is very, very prominently now coming up. Now he says, Doctor, I get fear of heights and I often get dreams of falling. Now, in many of my clients, what I see is that when the clients have a very high self-image of themselves or very high expectations of themselves, they see themselves at a high position, and then there is a fear of height. So this fear of height is not just a physical or emotional fear, but it is also a metaphorical fear. So they feel that they have reached a position in the society in their own eyes, and they don't want to fall from there. So there are dreams of falling, and there is fear of reaching this height. He says, Doctor, I have claustrophobia. I cannot wear tight clothes, tight ties, nothing. I cannot be in a closed room. And now my life has come to such a point that if I don't work, I feel very, very disturbed because I enjoy my work. But if I work, I get migraine. So, doctor, you tell me what do I do with my life? How do I live? How do I enjoy? So, in this way, this spontaneous narration ended. Fortunately for me, there was hardly anything that was left for me to ask. So now, with this kind of narration, I started wondering, how do I think about this case? How do I analyze this case? How do I come to a remedy? So normally when I'm taking the case, as far as possible, I refrain from uh, thinking about what kind of prescription I would make or what kind of remedy I would prescribe, because invariably that will prejudice our questioning or prejudice our understanding. So uh, instead of that, what I generally do is, being a counselor or being a regression therapist, I try to create more awareness by asking questions that will make the patient reflect on what he's saying. So generally in this kind of cases, I would ask the patient about what does height mean to him, or why he thinks that his job is risky. And this way, the client will be more and more aware about how he perceives himself and his life. So now, once the entire case is over, I would start thinking about what are the important facets of this case to understand what is happening in this case. First, I realized that his headache had lot of characteristic symptoms. Some of the characteristics were, as I told you, the heating of the head, and that's why the sun aggravation, light and sound aggravation. But very peculiar for me was the mental exertion. Doctor, if I'm just looking at my mobile or trying to fill out a form, I start getting headache. Don't you think this is very, very characteristic? Another thing that went through and through in the case, as if it's a theme in the case, was the theme of pressure. So the client felt that there was internal pressure in the head. He was better by hard pressure. And this then became the bridge between the emotional and the mental picture, the client's life and what is causing this headache, and the feel in the headache. So obvious connection was the pressure. The work that is causing this pressure was perceived as an extremely risky and dangerous work, and being blamed and defending or fighting back is a very important part of his work. So pressure is created from the risk, the danger, and the constant fight. Now, another thing that was very interesting, though this work is causing such a severe, painful complaint in his body, he says that I enjoy challenge, I enjoy work, I'm very ambitious. So obviously, there is this risk and challenge is something that he enjoys. So we have to select a remedy that loves challenges. So obviously, my first thought was the nitrogen component in the remedy. Now, I'm sure you all are aware that nitrogen is a gas that expands. So the expansion versus compression and pressure is a great theme in all the nitrogen remedies that we have. Now, again, nitrogen creates lot of heat in all the remedies that we have, like glonoine or amylum nitrosum. We have lot of heat with the patient, and the patient is better in open and cool air. Now, if you remember nitric acid has a very peculiar symptom, that delusion he is engaged in a lawsuit. What does that mean? So through my cases, I understood that being engaged in a lawsuit meaning you have to constantly fight and defend. So lawsuit is nothing but constant friction, constant fight, constant defending. And through my cases, I have understood that nitrogen component has two facets. One is that when it's a professional, it's a part of their profession, they love fighting back. But when it's a part of their personal life, they get highly disturbed by this constant fighting. So there is a component of enjoying this when you have to do it as a part of your job, but also getting aggravated by it. And obviously, we know in the remedies like Kali nitricum or gunpowder that danger or risk is a big theme, even argentum nitricum for that matter. So many of our argentum nitricum patients tell us that my work is like walking on a tightrope. They love this challenge and the risk element in their work. And again, nitric acid is one of our remedies which is very, very revengeful, very, very bitter. Holding grudges is one of the prominent features of nitric acid. So all this I could see in this case, this theme of pressure, this theme of risk and danger, loving the challenges, being bitter about what has happened in the past. So all that was important. And that's why I could spot the nitrogen component in this case. So very, very obviously what I did was I first repertorized all the headache rubrics. Now when I repertorized the headache rubrics, what I peculiarly, I took rubrics like headache on the right side, uh, preceded by the visual complaints, heat of the head, sun aggravates, mental exertion, pressure, better by pressure, all of this. And peculiarly, my glonoine caught my attention. Glonoine, as we all know, is a nitroglycerine that we use, and it's a remedy that contains a very high component of nitrogen. Very, very interesting, because even after taking the case, what I thought was of glonoine in the first place. But something was missing. I was not satisfied with my choice of glonoine. There was some other component besides nitrogen. So what are those components? I was not able to understand. So I decided that now what I would do is I would now think about what is not fitting into glonoine. So another thing that I commonly do in cases is that when I zero down on a remedy, I try to search what doesn't fit. Because commonly what happens with us is that in our choices of remedies, we generally, we are so prejudiced that we try to fit in all the symptoms in the given remedies. And that's why we miss the many, many important things that need to be covered. So I do generally exactly opposite to avoid this prejudice about remedies. So what I do is when I think of glonoine, I think of what doesn't fit in glonoine. All those things must be very important. So what are those? I said, now he is a very, very ambitious person. He's a very renowned professor and researcher. And imagine him working for more than 30 years and at the age of 75. So he must have done a deep study of his subject. and putting huge efforts. Imagine setting up a technology center at the age of 75. That's such a huge effort. And now somebody has given him the task of putting up a second technology center. So what I realized was, at this age, he's putting in huge effort and he has been doing it for a very long time. So this must be a very important feature of our remedy. Second thing, I realized that mental exertion is very clearly a important factor in this case, because a professor who's teaching all the time, a researcher like who's like a scientist who's doing study, analysis, lot of mental work, which he's unable to do now, which means brain fag has to be, or aggravation from mental exertion, or fatigue or prostration from mental exertion has to be in my remedy. The third thing that I saw was that he sees himself at the top, somebody who's valued, who's respected, and now fears falling. So efforts are not recognized, or there is unfairness, there is injustice. The value is not recognized. That is a very prominent feeling in this case. And walking on the tightrope, the risky nature of his work, and the fighting out. So all these themes have to be there in my remedy. So one more very important thing, right at the beginning of the case, he told me that, doctor, the sleeplessness or loss of sleep was like a red signal to me. So racing thoughts, the mental excitement that happens when he's given any task, and the sleeplessness that it causes has to be there in our remedy. So I realized that some of these features, I don't see glonoine or argentum nitricum or the common nitricum remedies covering. So now I wanted to search for a remedy that has all of this. So I now repertorized the mental symptoms. So many times I repertorize the physical characteristics separately and mental characteristics separately, because I want to see that if I prescribe on mentals, which is the remedy that comes up. If I prescribe purely on physicals, which is the remedy comes up, and then combine and see which remedy is present in all the three of my repertorizations. That would be my remedy. So here what I realized, that now when I take mental symptoms, argentum nitricum is coming up, which is again a nitrogen remedy. So I know that I am somewhere close. It is neither glonoid nor argentum nitricum. So I generally, what I do is, as you all know, that in the initial repertorization, this pulsatilla and sulfur and phosphorus and calcarea and natramure comes in all the repertorizations. So we pick out the remedies that normally are not seen for this kind of complaints. And when I start looking at the repertorization table, what I see here is a remedy that is a nitrogen component remedy, but a much, much lesser known remedy. And suddenly I start thinking, oh, picric acid. How does picric acid come here in this repertorization chart? Now I'm very curious to know the symptoms of picric acid, because I hadn't thought of picric acid at all. So I now take all the repertorization rubrics that I want to take, including my mental rubrics, including my physical rubrics. And picric acid is somewhere 9th or 10th. It's not the first remedy. I have just slided down my table and got the picric acid in the first position, so that you can see which are the rubrics that are covered and which are the rubrics that are not covered by picric acid. Now, interestingly, what you will see is picric acid is present, argentum nitricum is present, and glonoine is also present now. So you will see glonoine is covering all the symptoms of headache. Argentum nitricum has a good mix of mental emotional rubrics as well as rubrics of headache. And picric acid, if you see, is covering of some of very important rubrics of headache, though in lesser marks, like right-sidedness, visual aura, headache from mental exertion, headache pressure ameliorates, mental exertion ameliorates. Now, picric acid is very well represented in what the patient is actually experiencing in the level of mental exertion. So see the rubrics. Mental exertion aggravates, prostration of mind from slightest mental exertion. Very few remedies are present. I think only 8 or 9 remedies are present in this rubric, but picric acid is one of them. Rush of flow of thoughts with sleeplessness, and that is a very, very, again, important symptom in our case here at hand. So I feel very, very satisfied and curious about picric acid. So I'm now a little bit going to talk about picric acid to you and the group that picric acid belongs to. So I focused on picric acid, and as you can see, many of my important rubrics are straight away covered with picric acid. So I wanted to study then picric acid because I had never prescribed picric acid as a constitutional remedy to someone. I had used it for brain fag. I had used used picric acid for some of the other complaints, like some sexual complaints, but never really used picric acid for migraines. So when I started reading picric acid, I realized that picric acid is covered in 3 groups. Now, I studied picric acid from Roger Morrison's Carbon Remedies, and he has described it really, really well. So, picric acid scientifically is called trinitrocarbolic acid, and it has benzene ring, which is benzene, you know, is aromatic compounds with 3 nitrates and 1 alcohol group. So obviously, all the nitrogen symptoms are going to be very, very pronounced. But I was very curious and surprised to see the alcohol group present in picric acid, because I didn't realize how this value and being neglected or injustice or not given the recognition was covering up in this picric acid. But now, with the study of these 3 components, it will suddenly become clear to you how everything precisely fits into the case. So picric acid belongs to these 3 groups: aromatic compounds, which is benzene compounds, nitrates, and alcohol group. Now, interestingly, the name picric means in the Greek language, it comes from the word pikros. It means bitter due to its extremely bitter taste. As I always tell all my students and colleagues, that all the natural phenomena that happen with a compound are always the part of the symptoms of that compound. Now, if a substance is bitter, that means at the mind level also there is some bitterness that this substance exhibits. Now, in this case, we saw how bitterly this patient was holding on to the offenses that was done to him in the past. So I always see the physical phenomena or the characteristics of the source substance happening in some metaphorical form in the symptoms of the remedies. The other important thing about picric acid, as the greatest use of picric acid is in ammunition and explosive. Now, what kind of headache this person gets? Internal pressure, as if the head is going to burst out. So almost all the remedies which have this nitricum component will describe their headaches as pulsating, bursting out headaches, which is very, very peculiar. Now, I started studying the 3 groups that I described. The first group was benzene compounds. And as I told you that whenever I study a group, the group symptoms become very clear to me. And because we know now the entire group, how this particular small remedy fits into the group becomes very, very clear. So let's understand what are the peculiarities of these aromatic benzene compounds. Now, when I started studying, what I realized was that mental activity is one of the strongest characteristic of aromatic compounds. They always get lot of racing thoughts, and overthinking is one of the most prominent symptoms. So Roger Morrison says that these people have racing ideas, and there is so much of ideation that when they talk, they're almost pressurized to talk. So their talk is fast, they are very speedy and pressurized in their movement, and almost explosive in their demeanor or in their way of functioning. So racing of ideas excitement, fantasizing, ideation, creativity. So the positive aspect of these racing of ideas is naturally the creativity. A researcher, a professor, a scientist would need a lot of creative ideas. But if there is overthinking and overdoing of these creative ideas, then that's going to create a mental activity that is bothering the patient now. So one of the characteristics of this excitement in benzene compounds is also sexually fantasized ideas or sexual excitement. Now, peculiarly, these aromatic compounds are all bitter, and they are also bitter about their past. So they keep on brooding about the unpleasant and sad memories. And another very peculiar feature, as I told you about all the aromatic compounds, is that uh, they always describe everything as a pressure, and because of their pressure, they are better in open environment when there is no pressure. So there is compression, band-like sensations, and there is amelioration in open. Now, clearly, picric acid, in picric acid, we have this rapid racing thoughts and abundant ideas. Now, what are some of the other remedies in benzene compounds? I'm sure you know gallic acid, which is relatively frequently prescribed remedies, but also benzoic acid, benzene nitricum and dinitricum, and few people use picric acid and salicylic acid. So all these remedies are very, very good aromatic benzene compound remedies. Now the second group was the nitrate group. This group we are very familiar with because we have remedies like glonoine and amylum nitricum, which we prescribe very often. So we know that these are explosives and vasodilators. Nitroglycerin is used in angina, we all know that. And glonoine is very, very prominently used in explosive headaches. And in all the nitricum remedies, we know like argentum nitricum or glonoine, there is a sense of danger and risk. There is also explosion because all these are explosives actually used in various kinds of explosions. So this explosion is also seen in their behavior in terms of their temper, in terms of their outburst when it happens in anger or excitement. And in many cases, even Roger Morrison describes it, that these people are almost always afraid that when they express themselves, they will express themselves explosively, too forcefully. So their narrations are explosive, their anger is very explosive, their getting upset is very explosive, and these people are also very, very impulsive, just like an explosion. They think about something and they go ahead and do it. They don't think about the consequences. Obviously, we all know that nitrates have great affinity towards circulatory disturbances. So we get all kinds of hot flushes, pulsations, hypertension, which is aggravated by heat. And very peculiarly, these remedies are all aggravated by sun and aggravated by heat. We know glonoine, how glonoine is aggravated by heat. So interestingly, our client of today's discussion also had aggravation from heat. And he said that whenever I thought about the conflicts and fights or mental exertion, my head started getting very, very hot. So nitrate remedies are very prominent remedies for some of the most severe pulsating migraines. And as I already told you, amylum nitrosum and glonoine are the very important remedies that we use. Now, very interesting for me was the alcohol group, which I didn't realize that picric acid had. And alcohol group always has this feeling that they are not valued or they are not understood. So these people have some traits like childlike traits where they depend on other people, but they feel that people whom they are dependent on, these are the same people who are letting them down, or these are the same people who are not treating them well. And when they get this feeling, they react very aggressively or abusively. So, this picric acid trait of not being valued or respected is coming down from this alcohol group. These people peculiarly feel that people are not listening to me carefully, they are not valuing my suggestions, And there are two extremes here. So, group of remedies like Saccharum officinalis, either they are very aggressive or they are extremely inhibited. So, if you have to look at the remedies that belong to this group, like ethyl alcohol, like glycerine, like Saccharum officinalis, you will see that in these remedies, you will have this long held grudges. You did this to me 10 years ago, and they are bitterly holding on to this, the past offense. So, very interestingly, Saccharum officinalis can be extremely sweet in some instances and extremely bitter in the other instances. So, this the client, the picture of the client that we had today of not valued, not given enough recognition, injustice, not understood, is coming from the alcohol group of today's remedies, alcohol group of remedies. After studying these three groups, it was a very, very interesting study for picric acid for me. Picric acid, as you all can see, it's a bright yellow powder. I told you about its bitter taste. Interestingly, just like glonoin, it is very, very sensitive to shock and friction. Remember how the patient got aggravated from friction, fights, and conflicts? So picric acid also needs to be stored under a layer of water, because slightest amount of friction and it can become very, very dangerous or explosive. Picric acid is very, very hazardous in the way that it even reacts with the containers. So it has to be stored with inert containers. Now, in many of our homeopathic remedies, we have seen that yellow remedies generally act very powerfully on liver and bile. And picric acid has the most prominent characteristic, as Clark says it. It has a feeling of tired out or washed out feeling. And that is the chief keynote of picric acid, which we saw in this case. So I will now share quickly some of the very important rubrics that I saw in picric acid. And I'll tell you how I went ahead with this patient and what kind of potencies I gave him. So the first group of rubrics that I'm going to show you are relating to mental activity and brain fat. So as you can see, picric acid gets headache from excitement, but also dullness from mental exertion, dullness, unable to think long. And whenever you will see these two stars at the beginning of the rubric, that means that is the single rubric of picric acid, which means picric acid is the only remedy present in that rubric. Now imagine, in dementia, acute dementia, picric acid is the only remedy in our materia medica. That means picric acid affects our memory in a great importance or great intensity. So forgetfulness from mental exertion, forgetfulness from long study, forgetfulness from study in young people. Now we saw that this person had a prolonged history of long study, but even if you get this problem in young people, you can give picric acid. And yes, I have used picric acid for students who have been studying really hard for competitive exams and suddenly feel that my brain is so frustrated that I cannot remember what I have studied. So in these kind of people, I have used picric acid in the past with great success. So picric acid is a remedy where the person has been applying his brain for a very long time. There is an acute condition of brain fat, and now the person feels, I can't remember any of the studies that I have done. Now, the ambition. What was very interesting about picric acid was the way it was portrayed in the rubrics in relation with its ambition. Now, picric acid had two rubrics. One was that the body is enlarged. Now, whenever the person or whenever the rubric says the body is enlarged, it is generally that these people either feel that their presence is enlarged and they are not present in the body fully, or they feel a magnitude, a superiority, a kind of value that feels enlarged. So it can be related to ego also. So in this remedy, in picric acid, what is very peculiar is that you will see a rubric, which is a single rubric again, that body parts reach the clouds when he's trying to fall asleep, or arms reaching the clouds. Now, when do we say that only sky is the limit? When we have ambitions going towards the clouds, the sky. So for me, this rubric means that this person is very, very ambitious, trying to reach to a height which is almost impossible. There is another rubric called tongue reaching the cloud, which simply means that this person wants to reach out to a limit or a height which is almost impossible. And you have seen that this client of ours today, he says that he's a very ambitious person. Somebody who is working till 75 years of age, building technology centers one after the other, you can almost understand his ambition. Interestingly, a pressure element comes very peculiarly in picric acid. It has a rubric that he is crushed, and the single rubric that he is crushed by bedclothes. Now, you know how heavy bedclothes can be. If somebody is feeling crushed by bedclothes, that means this person has a feeling that there is a huge burden of him on him, and he feels even by slightest burdens he feels totally pressurized. That is what I understood from these rubrics. Brain fag, I think one of the excellent remedies of brain fag, and you will see that it is a 4-mark remedy in prostration of mind from business, from mental exertion, from slightest mental exertion, from reading. It's a remedy of prostration in teachers. And another very important rubric, prostration of minds after shock. So there is some shocking instance after which he feels that he cannot apply his mind at all. Excitement. I told you that picric acid and generally all the aromatic compounds are very, very excited people. So in picric acid, there is anticipation of exam. Again, a very important remedy for students. And prolonged anxiety, like prolonged waiting for an exam, prolonged preparation for an exam would aggravate. Picric acid has suicidal disposition from being overworked and being worried. So these are the two things which causes him to get very, very depressed. Of course, picric acid is known for its sexual excitement. So there are some sexual rubrics like insanity from masturbation or sexual eroticism or lascivious dreams. And many times picric acid is used in people who get sexually excited as well as people who are very, very intellectual and find some kind of relief in their sexual excitement. So I have used picric acid in these kind of cases also. So we will see that picric acid has these 2-3 elements which are exact match in this case. One is the element of brain fat. The second is the element of ambition, pressure, and excitement. And third is the element of all this nitrogen or the alcohol element of being not respected, not valued. So how did the follow-up go? First of all, I started with picric acid 200. And I needed to give really, really frequent doses because this person was taking 3 painkillers a day, remember? So within about 15 days time, he said, now I'm taking just 1 painkiller a day. So the painkiller doses reduced. Interestingly, the aura stopped immediately. The flickering of light stopped immediately in the first week. So whenever he would get headache, he would not get the aura. And the intensity was of the headache was much less. 1 painkiller was often enough. Now, what I realized was picric acid would not help this person in acute headache. So I was thinking of hiking up his potency, but what happened was when once I gave him 1 m, the headache became very, very less in intensity as well as frequency straight away for 3 months. His sleep improved, his overthinking reduced, his excitement reduced, and he could start, with reading of newspaper, some small work, some sending of emails. That became possible for him. Now, unfortunately, when he started working again, he was called on his project again. And the moment he started working on his project, the headache came back with a bang. Again, aura happened, severe headache, 3 painkillers again happened, and this time I gave him picric acid 10 mg, and the 10 mg brought him a lasting improvement. So he had to stop his work for temporary some time, for some temporary work period, but he could resume his work slowly after giving around 1 or 2 doses of 10 mg at the intervals of 3 weeks. And then his headaches became very, very less frequent. But whenever the headache would appear, I would see if there was excitement or if there was a feeling of, sleeplessness or fatigue or this past grudges coming back. Only then I would repeat 10 mg. Interestingly, in acute headaches, when I tried repeating Glonoin, it failed. Generally, what I do is, if my main remedy is from belonging to a nitrogen family or some peculiar family, then in acute also I try to give a remedy from the same family. So for a picric acid person, I would first try Glonoin for his acute headache, but Glonoin failed, and Sanguinaria nitricum was very, very helpful. Again, a remedy with another nitricum helped him in acute headache. So every time the headache would repeat, I would not give him picric acid, but I tried giving him Sanguinaria, and the headache would act like a crocin or a painkiller for that time, and his headache would go down. And whenever his overall personality would have an aggravation, I would repeat picric acid. So in this way, I think his treatment is going on for almost more than a year now, and his headache have settled down completely. He's able to work very well, and this case gave me lot of satisfaction in terms of the result, because he was a very high performer. He was doing some great work for India, and I felt that was my small contribution in his work. So this way, what I understood from this case was that whenever you study a group, you get a larger map of what is happening in that group of remedies, and with the help of those symptoms, you can then trace or zoom into lesser known smaller remedies which are not so well represented in the repertory. Now, if you will see delusion not respected or not valued, or appreciation lack of, in all these rubrics, picric acid you won't see. But if you understood that picric acid has an alcohol group which covers all these remedies, then you can guess these blank spaces. Like, for example, picric acid is not present in sun aggravates, but we know that nitrates have this feature of sun aggravation, or the feature of risk or danger part of the story. So what I understood was that if our larger group covers some symptoms, then they may not be present in the lesser known remedies because they are not studied to that depth, probably. And these blank spaces we can fill up due to our group study. And when we get very, very important 1 or 2 keynote symptoms of that particular remedy, then that becomes a confirmation enough. Like in this case, the prostration of mind, the sleeplessness from the mental exertion, or the tremendous ambitiousness with arms reaching the cloud. These are the very, very important keynotes that got covered in this peculiar remedy. And that was a confirmation symptom. And I could use this lesser known remedy for this wonderful case. So generally, whenever I prescribe remedies, I try to study the group. I try to study what are the peculiarities of individually lesser known remedies and try to use them as much as possible. So we come to the end of my talk today. I hope this sharing of this case, knowing a little bit more about picric acid, would help you today in some aspects. And I hope that you also start using the group study to know peculiar lesser known remedies and make use of these remedies. So I thank all of you for joining me today, and for your interest in today's talk. Thank you so much. These are some of the details that I have. Please do visit my YouTube channel. There are some interesting videos about psychology there. You will like them. And if there are any questions, I would like to definitely take up the questions. And I don't know how you're supposed to ask the questions on chat, or you can unmute yourself and ask questions. But definitely, I would like to take up if there are some questions available from the group. So there are 2-3 comments that I see. Children who play video games continuously every day plus schoolwork, can picric acid suit to these kind of children? So if you see that there is a mental prostration in these kind of cases, only then you can use picric acid, because all of us are doing lot of mental work, and not everybody feels mental exhaustion after doing this mental work. So children who play video games can very well be some other remedies like plastic, or there are some very good remedies like scorpion for video game addiction. So if you think that it's the video game addiction is the focus of this remedy or of this case, then some other remedies would come up. But if you think that doing a lot of mental work plus doing a lot of gaming is exhausting this child, and this child is being now prostrated and forgetful, then maybe picric acid could be a very important rubric. So the second question is, does picric acid suit oxygenized constitution more than phosphoric acid? Now, I am not sure about oxygenized constitution in phosphoric acid itself. So I don't use this carbonitrogenoid and oxygenoid constitutions a lot. So I'm probably not the best person to ask this to answer this question. But constitution wise, I think picric acid goes closer to the carbon and the nitrogen group, and phosphoric acid is more about the emotional exhaustion. As far as I know, phosphorus is a very emotional, affectionate person. And when there is lot of emotional involvement, like in the relationships or in friendships or in the family, and something happens, and this deep emotional involvement is now suddenly you cannot get reciprocated, and you have got involved so much for so long that you feel extremely tired of your emotional involvement, then I would rather use phosphoric acid. Whereas in picric acid, it's the intellectual and mental involvement and racing thoughts that I would use picric acid for. In chronic fatigue syndrome, which acid is the best? Now we have fatigue as a feature of almost all acids, and it depends upon which of the aspect. Like for example, muriatic acid is extremely fatigued, and muriaticum, so natrum kind of a picture where there is a lot of emotional involvement, but there is a lot of ulceration in the body, then you will use muriatic acid. You will use sulfuric acid when the patient is very, very hurried. So all our acids are extremely good remedies for chronic fatigue syndrome, depending upon which is the highlighted aspect. Like for acetic acid, the acidity is the important element. For nitric acid, the mucocutaneous junctions, the nitrogen themes, the engaged in a battle kind of a feel is important. So depending upon which is the highlighted area in your particular case, you can use acids in chronic fatigue syndrome, definitely. For children with OCD, will picric acid work? Again, now OCD has a very different presenting picture. OCD meaning the person repeats the actions all the time for relieving some kind of anxiety. And we have a lot of other remedies for compulsive disorders like medorinum, like thuja, like lac-caninum, like anacardium. So picric acid will not be the first remedy that will come to my mind, simply because picric acid is not a compulsive doer. It is a compulsive thinker. So if you are saying that somebody has obsessive compulsive neurosis, meaning persistent thoughts of one kind, and that's why the person is getting exhausted. So again, I want to mention this, that it's not so much that the racing ideas or the mental work, but if you are exhausted due to the mental work, if you are frustrated, if you are forgetful due to the mental work, then picric acid would be the right choice of the remedies. So I answered almost all questions on the chat. If there are any more questions, I would really like to take them up. And again, I would like to thank all of you for joining today and being patient with this talk today. And thank you so much from my side.
Thank you so much, ma'am.
Thank you.
Yeah. Today we
So
have
are there any more questions, or do we end for today?
No, ma'am. Only this.
Thank you. Okay. Thank you so much. Then I thank the organizers also for having me here and giving me this opportunity for sharing my way of prescribing and sharing this wonderful case. Thank you so much.
Thank you.